While much of the world assumes Africa will be blindsided by the next pandemic, African nations are quietly building new defenses, transforming a legacy of vulnerability into a story of innovation and resilience that could redefine global health security in ways few expect. Before we get started, I want to invite you to be part of this movement. If you're watching, you care about Africa's future and the truth behind the headlines. Your subscription, your likes, and your shares are what help us bring these underreported stories to the world. By joining our community, you're not just supporting independent journalism, you're helping amplify African voices, fuel research, and ensure that vital conversations reach more people. If you believe in the power of knowledge and collective action, subscribe now and let's shape this conversation together. Let's begin by unraveling the mystery at the heart of this story. What exactly is the Nipah virus, and why does it inspire such global anxiety? To answer that, we need to travel back to the late 1990s, when a strange and deadly illness swept through Malaysia's pig farms. Farmers and their families began falling ill with fever, confusion, and in many cases, severe brain inflammation. The culprit was soon identified as a new virus carried by fruit bats, Nipah virus, or Ni-V, a member of the Nipah virus genus. Its natural hosts, the flying foxes of the genus Pteropus, are found across South and Southeast Asia and on some islands off Africa's coast. The virus can leap from bats to other animals, especially pigs, and from there to humans. What makes Nipah especially alarming is its ability to spread directly from person to person, as well as through contaminated food or close contact with infected animals. Nipah virus infection can present in many ways, from mild respiratory illness to acute encephalitis, a dangerous inflammation of the brain. In severe cases, patients may experience drowsiness, confusion, seizures, and even coma. The World Health Organization classifies Nipah as a high-risk pathogen, not only because of its lethality, but also because there is currently no vaccine or specific treatment. Mortality rates in past outbreaks have ranged from 40 to 75%, making it one of the deadliest viruses known to infect humans. Recent data shows that outbreaks in Bangladesh and India have demonstrated how quickly Nipah can devastate communities, overwhelming local health systems and causing widespread fear. What truly sets Nipah apart from other emerging diseases is its pandemic potential. The virus's ability to move silently from bats to humans, its high fatality rate, and the absence of effective medical countermeasures create a perfect storm. Outbreaks in Bangladesh and India over the past 2 decades have shown how quickly Nipah can devastate communities, overwhelming local health systems and causing widespread fear. But what about Africa? Is the continent at risk? And if so, how prepared is it to face a threat like Nipah? To answer that, we need to examine the ecology of the virus, the continent's public health infrastructure, and the lessons learned from recent epidemics, especially COVID-19. First, let's look at the risk of Nipah virus actually emerging in Africa. According to recent data from the World Health Organization and the Africa Centers for Disease Control and Prevention, there have been no documented human outbreaks of Nipah virus on the African continent. The primary reservoir, Pteropus bats, are not present on mainland Africa, although they do exist on some offshore islands like Pemba and Madagascar. However, studies have detected antibodies to Nipah viruses in African bat populations, and there is evidence of related viruses spilling over into humans in countries like Cameroon. This means that while the immediate risk is low, the potential for future spillover events cannot be ignored, especially as environmental changes bring humans and wildlife into closer contact. Environmental changes such as deforestation, urban expansion, and climate change are all driving forces behind the increased risk of zoonotic diseases. As natural habitats shrink, Bats and other wildlife are forced into closer proximity with human settlements, creating new opportunities for viruses to jump species. In regions of Africa where population density is high and human-bat interactions are frequent, the risk of spillover events is rising. Recent outbreaks of other zoonotic diseases, such as Marburg virus in Equatorial Guinea and Tanzania, serve as stark reminders of how quickly a new pathogen can emerge and spread. Reports indicate that nearly 75% of emerging infectious diseases in Africa are zoonotic, often linked to ecosystem disruptions. But risk is only part of the story. The real question is whether Africa is ready to detect, contain, and respond to a Nipah outbreak if and when it occurs. Here, the picture is complex. On one hand, many African countries face significant challenges in terms of public health infrastructure, surveillance capacity, and access to diagnostic tools. Most wildlife disease diagnostic facilities are limited, with many countries relying on livestock disease laboratories that are not equipped for specialized viral testing. This gap in surveillance makes early detection of emerging threats like Nipah difficult. According to recent assessments, countries such as Somalia and Uganda lack efficient health preparedness plans to address epidemics effectively, while Ghana and other West African countries remain highly vulnerable to zoonotic spillovers. On the other hand, the COVID-19 pandemic has catalyzed a wave of reforms and investments in public health across the continent. African health authorities have recognized the importance of digital health infrastructure, telemedicine, and remote healthcare solutions. The Africa CDC, in partnership with international organizations, has expanded its role in coordinating pandemic preparedness and response. New funding from initiatives like the Pandemic Fund and the Preparedness and Resilience to Emerging Threats Initiative is helping to strengthen surveillance, laboratory capacity, and epidemic intelligence. The Pandemic Fund's Governing Board, for example, recently approved $500 million in new grants to strengthen pandemic prevention, preparedness, and response in Africa. Yet, these advances are not uniform across the continent. Some countries, such as Ghana and Uganda, remain highly vulnerable due to limited resources and weak health systems. Others, like South Africa, have more robust infrastructure but still face challenges in early detection and rapid response. The World Health Organization continues to classify Nipah as a priority pathogen, underscoring the need for vigilance and preparedness in all regions. So, which African countries are at highest risk if Nipah were to emerge? The answer depends on a combination of ecological, epidemiological, and infrastructural factors. Regions with significant bat populations, high levels of human-bat interaction, and dense human settlements are most vulnerable. Central African countries like Cameroon, where evidence of Nipah virus spillover has been documented, are on the front lines. West African nations with histories of zoonotic outbreaks, such as Ghana and Nigeria, also face elevated risk due to environmental changes and limited surveillance. Madagascar, with its unique bat populations, is another area of concern, especially given the detection of Nipah virus antibodies in local wildlife. To understand the stakes, let's take a closer look at how Nipah virus outbreaks have played out in other parts of the world. In Malaysia in 1998, a Nipah outbreak devastated the pig farming industry, resulting in the culling of over 1 million pigs and causing economic losses exceeding $600 million. The outbreak spread rapidly from pigs to humans, leading to more than 100 deaths and widespread fear. In Bangladesh and India, repeated outbreaks have highlighted the virus's ability to jump from bats to humans through contaminated fruit or palm sap and then spread from person to person within families and communities. These experiences offer sobering lessons for Africa. The economic impact of a Nipah outbreak would extend far beyond the immediate health crisis. Key sectors such as livestock, agriculture, tourism, and trade would be at risk. Farmers and their families could face devastating losses if livestock are culled to prevent the spread of the virus. Fear and uncertainty could reduce tourism and disrupt local economies, compounding the impact of the outbreak itself. The indirect costs of an outbreak can be even greater than the immediate health impacts. Reduced trade, lower consumption of livestock products, and decreased economic activity can lead to long-term instability. The Ebola outbreak in West Africa, for example, caused billions in economic losses and set back development for years. The threat of Nipah, even if it never materializes, is a reminder of the need for robust economic and social safety nets. Environmental factors are also shaping the risk landscape. Deforestation, resource scarcity, and climate change are disrupting natural habitats and increasing the likelihood of zoonotic spillover events. As wildlife and humans come into closer contact, the risk of new diseases emerging grows. Addressing these challenges requires a holistic approach, integrating public health, environmental protection, and sustainable development. The role of culture and religion in shaping disease response and vaccination attitudes cannot be overstated. In some communities, religious beliefs have been a barrier to vaccination, with leaders branding vaccines as incompatible with faith. In others, cultural practices such as burial customs have conflicted with public health measures, leading to resistance or denial. Social norms, gender roles, and local traditions all influence how communities respond to health interventions. Yet culture can also be a source of strength. When local leaders are engaged and respected, they can play a powerful role in promoting health and preventing disease. Community-based approaches that respect local values and traditions are often more effective than top-down mandates. The challenge is to find the right balance between respecting cultural diversity and ensuring public health. Let's return to the question at the heart of this documentary. Is Africa ready for the Nipah virus? The answer is neither a simple yes nor a definitive no. The continent faces real challenges, from limited surveillance and diagnostic capacity to vaccine hesitancy and economic vulnerability. But it is also a place of innovation, resilience, and growing capacity. The COVID-19 pandemic was a wake-up call, exposing weaknesses but also sparking reforms. African governments, health systems, and communities are better prepared today than they were a decade ago. Investments in digital health, telemedicine, and epidemic intelligence are paying dividends. International partnerships are bringing new resources and expertise, but the work is far from finished. Preparedness is an ongoing process, not a destination. It requires constant vigilance, investment, and adaptation. The threat of Nipah virus may be low today, but the forces driving zoonotic disease emergence are not going away. Climate change, deforestation, urbanization, and global travel will continue to shape the risk landscape. The future of pandemic preparedness in Africa will depend on the ability to learn from past experiences, adapt to new challenges, and build systems that are flexible and resilient. It will require strong leadership, community engagement, and international solidarity. Above all, it will require a commitment to equity, ensuring that all people have access to the tools and resources they need to protect themselves and their communities. As we look ahead, there are reasons for cautious optimism. The lessons of COVID-19 have not been forgotten. African countries are investing in health systems, building partnerships, and developing new technologies. Communities are becoming more engaged and informed. The global health community is paying closer attention to Africa's needs and priorities, but there are also reasons for concern. The risk of emerging infectious diseases is rising, driven by environmental, social, and economic factors. Surveillance and diagnostic capacity remain limited in many regions. Vaccine hesitancy and misinformation continue to undermine public health efforts. Economic vulnerability and social inequality make it harder to respond to crises. The challenge for Africa and for the world is to turn these risks into opportunities for transformation. By investing in health systems, strengthening surveillance, and building trust with communities, African countries can become leaders in pandemic preparedness. By working together, sharing knowledge, and supporting one another, we can build a safer, healthier future for all. Let's take a moment to synthesize what we've learned. Nipah virus is a deadly threat with pandemic potential, but its emergence in Africa is not inevitable. The continent faces real challenges, but also has unique strengths. The lessons of COVID-19 have spurred innovation and reform, but much work remains to be done. Preparedness is a shared responsibility requiring action from governments, communities, and individuals alike. As we close, I want to leave you with a question. What do you see as the strongest force shaping Africa's future in the face of emerging health threats? Is it the resilience of its people, the leadership of its governments, or the power of international collaboration? Share your thoughts below, and let's keep this vital conversation going.